Hi everyone, my name's Mia and I have a plethora of chronic illnesses, most of which send me to the emergency room or A&E. Someone on TikTok asked me for a more lengthy guide on how to survive an emergency room or an A&E with chronic illnesses. So this is that guide. I always attend with a handwritten note. On the note, I always write down all of my medications, all of my allergies, my emergency contacts, and which conditions I have. It's really easy to forget once you get to A&E what's happened, why it's happened. So it's really good to either bring someone along with you that knows exactly why you're there or have it written down as well. Now, I had a bit of backlash on TikTok for this one, but I do bring my medications, everything that I could possibly need while in there. I have my allergy medications, my anti-nausea meds. If I'm going to take them, I let a nurse know. Might be a bit of a hot take. This is not medical advice. I bring my compression socks, and this is so important for me. I spend most of my day with my feet raised. I'm sitting cross-legged, or I have my legs out on a sofa, or I'm lying in bed. When I'm in A&E, my feet are often dangling off chairs and on the floor. This makes my feet go freezing cold and painful. This might not be the same for your condition. I bring snacks. I bring snacks for the person I've brought with me. And also there has been times where I've gone into A&E and I am able to eat, and I've checked with the nurses and doctors to make sure that I can, because you never know how long you're going to be in there. Water bottle. This is my best friend. I bring this everywhere. I don't want to get caught out in a situation where I have no access to water. Sometimes they give you water bottles. I bring my own. I always bring a fluffy comfort blanket that I only use for hospital settings. As an autistic girly, blankets are essential. I also have a list of notes on how to advocate for yourself, and this is something I really struggle with. Again, I am autistic. I don't have the best communication skills, as you can probably imagine. So I refresh my memory if I can, if I'm able to, before I go. If you can bring someone with you, please bring someone with you. It's always nice to have someone with you, just in case there's an emergency that isn't loud or isn't obvious. And that's pretty much it. The only other tips that I really have for you is if you feel something is wrong, tell them. If you're in pain, nag them. They get so busy that they forget what they were doing. If they've gone to get you pain meds and they haven't come back with pain meds, ask them again. Please, please, please advocate for yourself and never feel like a burden, because you're there for a reason. See you next time.